Hi, my name's Marie and I'm going to be your nurse today. Can you tell me your name and date of birth?
My name is Frankie. My date of birth is 11/26/06.
Okay, do I have permission to do a head to toe exam on you today?
Yes.
Okay, I'm going to wash my hands. Ricky, what gender do you identify with?
Male.
Okay, patient appears stated gender and age. Patient has fair skin. Ricky, where are you right now?
I'm in Quincy at my house.
Okay, and what day of the week is it?
Sunday.
And who's the president?
Donald Trump.
Patient is alert and oriented times 4. Patient's behavior is cooperative. Patient appears calm and relaxed. Patient speaks fluently in English and speaks articulate. I watched the patient walk in. His gait is smooth and coordinated. I'm going to take the patient's vital signs. Blood pressure first. A normal blood pressure is 120/80. I'm going to take the radial pulse. A normal radial pulse is 60 to 100 beats per minute. I'm going to continue appearing to take the radial pulse while I assess respiration. Normal respiration is 12 to 20 breaths per minute. I'm going to take the patient's temperature under his tongue. A normal temperature is 90 to 100 degrees Fahrenheit. I'm going to take the patient's O2 saturation. A normal oxygen saturation level is 95 to 100. Now I'm going to assess the patient's skin. His skin is intact. There are no lesions, no edema, no masses. And patient's skin has rosy undertones, fair skin but rosy undertones. Okay, and now I'm going to assess the patient's head and face. Can I touch your head, Frank?
Yep.
Okay, so patient's cranium is normal cephalic. There are no infestations, no flaking. Hair is well distributed. No alopecia. I'm going to assess the face. The face is appears symmetric. There are no involuntary movements. Skin is intact, no lesions, no edema, no masses. Frankie, can you scrunch your eyes tight and open them? Great. Can you pucker your lips? Can you smile? Can you blow air from your cheeks? And resist me pushing. Okay. Now, cranial nerve 7 facial is intact. Next, I'm going to check for soft touch. Frankie, can you close your eyes and tell me when you feel touch? And where?
I feel on the left side of my forehead, left side of my cheek, left side of my chin, right side of my chin, right side of my cheek, right side of my forehead.
Very good. Now I'm going to have you clench your teeth together while I palpate your temporal and masseter muscles. Okay? Temporal, masseter. Now resist when I try to open your chin. Very good. Cranial nerve 5 trigeminal is intact. Now I'm going to palpate your sinuses. Can you tell me if you feel any tenderness?
Sure.
These are the maxillary sinuses. These are the frontal sinuses. Any tenderness?
No.
No tenderness in the sinuses. Now I'm going to assess the nose. The nose appears symmetric. There are no lesions or masses. Can you lift your head up for me? The septum lies midline, is symmetric. I'm going to look. There's no discharge, no obstruction. The buccal mucosa is pink and moist. There are no deformities. And now, Frankie, can you cover one nostril and blow out the other side? Can you do the same thing on the other side? Nares are patent bilaterally. Now I'm going to assess the patient's lips, mouth, and throat. Patient's lips are pink and moist. Can you smile and show me your teeth? Teeth are white, no rotting. Can you show me both the sides of your gums? Okay. Gums are pink, no lesions. Can you open big for me? Tongue is pink and well hydrated. There are no lesions. Buccal mucosa is also pink and hydrated with no lesions. The soft and hard palate are pink with no lesions. The Pharynx has no erythema. There's no cobblestoning. The tonsils are a 2+. And now, Frankie, can you say ah? Stick with your tongue. Okay. The uvular and soft palate rise in the midline upon phonation. And I will elicit a gag reflex by putting a cotton swab on the back of the patient's pharynx. So, cranial nerve 10 vagus is intact when the uvula rose on the midline, and cranial nerve 9 glossopharyngeal is intact with the gag reflex. And Frankie, can you stick your tongue straight out and side to side? Okay, and the tongue protrudes on the midline, so cranial nerve 12 hypoglossal is intact. Now I'm going to inspect the neck. And I'm going to look. There are no lesions. There's no edema, no bulges or masses. Frankie, can you turn your head to the left? I'm going to look for the jugular venous pulsation, which I can see. There's no jugular venous distension. I'm going to palpate the carotid artery on the right side, which is a 2+. On the left side is also a 2+. Now I'm going to listen with the bell for any bruits in the carotid arteries, and no bruits heard on the right, no bruits heard on the left. I'm going to have the patient, okay, Frankie, can you shrug your shoulders while I'm putting pressure on them? Okay, great. So the trapezius and the sternomastoid muscles are intact. The cranial nerve spinal 11 is intact. Actually, I'm going to have you turn your head to the right upon resistance on the left. Okay, now I'm going to have you do the same thing on the right. Okay, very good. So cranial nerve 11 spinal accessory is intact. Okay, now I'm going to assess the eyes. I'm going to look at the external eyes first. The eyebrows are symmetric. There's no alopecia. The hair is well distributed. There is no flaking. The eyelids have no edema. The eyelashes are inverted. I'm going to have you look straight ahead. The cornea is transparent bilaterally. And can you look at me? The irises are green, round, and equal. I'm going to look at the conjunctiva. Is pink and well vascularized. Now I'm going to have you turn to the side while I check for perla and EOM. So first I'm going to have you look straight at me while I shine the light in your eye to see if your pupils constrict. And that one does, and I'm going to do it again to see if the opposite one constricts. And it does. Now I'm going to check the other eye. Pupil constricts. Opposite pupil also constricts. Now I'm going to have you follow the pen line. Very good. And then keep following it. Okay, so pupils are equal, round, reactive to light accommodation. Extraocular muscles are intact. Cranial nerves, 3 oculomotor, cranial nerve 4 trochlear, and cranial nerve 6 abducens are all intact. Now I'm going to do a visual acuity and fields by confrontation. Can you tell me what you can read on this calendar for the month?
May.
Very good. And can you cover this eye and tell me when you see my fingers moving, okay?
See it. See it. See it.
Okay, now cover the other eye. Can you see my
See
finger?
it. See it. See it.
Very good. So, cranial, cranial nerve 2 optic is intact. Okay, so now I'm going to assess the patient's ears, and I'm going to start with a whisper test. So I'm going to cover this ear. I'm going to whisper something behind your back. You tell me what I said.
Ice cream.
Very good.
Pizza.
Very good. Okay, cranial nerve 8 acoustic is intact. I'm going to inspect the external ear. It is symmetrical. There are no lesions, no masses, there's no edema, there's no obstruction, and I do not see any cerumen, and I would do this bilaterally. Now I'm going to take the otoscope and I'm going to hold it in this position with my finger on the patient's face in case the patient moves. I'm going to hold the pinner, back it up, and have you tilt your head to the side. Very good. Now I'm going to look inside the ear canal. The tympanic membrane should be gray, curly gray, translucent and shiny, slightly convex, with the cone of light at 7 o'clock on the left side and at 5 o'clock on the right side. I should be able to see the bony landmarks behind the tympanic membrane. Okay, so now I'm going to start the cardiac exam. I'm going to inspect. You can turn back to look. There are no accessory muscles used. I don't see any heaves. The PMI is not visible. I'm going to palpate for thrills in the aortic valve, pulmonic valve, tricuspid valve, mitral valve, and I'm going to palpate the PMI, which is felt. There are no thrills felt. I'm going to take an apical pulse for 30 seconds, and I'm going to times that by 2. And I took Frankie's apical pulse earlier. It's an 86 with a regular rhythm. Now I'm going to auscultate again with the diaphragm and the bell in all 4 valves. Aortic valve, pulmonic valve, tricuspid valve, mitral valve, and now with the bell. Aortic valve, pulmonic valve, tricuspid valve, mitral valve. The heart sounds are crisp and clear. There are no bruits or murmurs heard. S1 is heard loudest in the tricuspid and mitral valves, and S2 is heard loudest in the aortic and pulmonic valves. Now I am going to do a pulmonary exam, and I'm going to start with inspection of the shape of the chest, and I will measure this way and then this way. An AP lateral is a 1:2 ratio. There is no barrel chesting. There is no tripod position. There are no accessory muscles used. I'm going to have you stand up, Frankie. Turn that way. I'm going to touch your back. I want you to say 99 when I touch your back in all lung fields, including the right middle lobe, okay?
99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, all lung fields, vibrations are felt in all lung fields and descend in lower lobes. Now I'm going to take chest expansion test. So I'm going to put my hands in a W shape right below your last rib and pinch the skin a little. Can you take a deep breath? Great. Lungs expand bilaterally. While I'm back here, I'm going to test your CVA tenderness. So I'm going to put my hand between the spine and the last rib. So I'm just going to palpate Tell me if you feel any tenderness.
Nope.
Okay, no CVA. Now I'm going to auscultate with the diaphragm on all lobes. Just take a deep breath when I touch, okay? Auscultation. Lung sounds are clear to auscultation in all lobes, including the right middle lobe. No wheezing, no ronky, no stridor, no crackles. Can you turn around? Okay, and now I'm going to auscultate anteriorly. I just have you do the same thing, okay? Take a deep breath. Very good. All lung fields are clear to auscultation. No wheezing, no ronky, no stridor, no crackles. Okay, now I'm going to start your abdomen exam. If you can just lie down for me, please. Okay, now I'm going to assess the abdomen for symmetry. The abdomen is symmetric, it's flat, there are no lesions, there are no obstructions or bulges. The aortic pulse is seen, the umbilicus is inverted. I'm going to start out with auscultation of the arteries with the bell, starting in the aortic artery. Now the right renal artery, the left renal artery, the right iliac artery, the left iliac artery. No bruits are heard. Now I'm going to listen for vowel sounds in all four quadrants, moving clockwise, starting in the lower right quadrant. Vowel sounds are heard and they are normal reactive. They're normal active. Now I'm going to auscultate, I'm going to palpate with light and deep palpations, starting with about 2 centimeters deep in clockwise, starting in the right lower quadrant. You tell me if you feel any tenderness, Frankie. Okay. Now I'm going to do deep palpations about 5 centimeters deep. Tell me if you feel any tenderness anywhere, okay? No tenderness, no guarding, no enlarged organs, no no bulges, no obstructions. Okay, now we're going to move on to the lower extremities first, since you're laying down. And I'm going to inspect for color. There's no cyanosis, there's no pallor. Cap refill is less than 2 seconds on both sides. There are no precocities. Hair is evenly distributed and light. I'm inspecting the ankles, knees, and hip joints. There's no redness, there's no deformities, there's no edema. I'm going to take the pulses, and the femoral pulses are a +2 bilaterally. The popliteal pulses are a +2 bilaterally. The posterior tibial pulses are a +2 bilaterally. The dorsalis pedis pulses are a +2 bilaterally. Now I'm going to assess muscle strength. The muscles are symmetric, there's no atrophy. Frankie, can you push your legs up? Okay, muscle strength is a +5. Can you push your feet back? Very good. Can you push your feet forward? Very good. Muscle strength is a +5. Okay, now I'm going to assess range of motion. I will do this bilaterally. Flexion, extension, abduction, adduction, external rotation, internal rotation, dorsal flexion, plantar extension, internal rotation, external rotation, and again this would be done bilaterally. Range, patient has full range of motion, no limitations. Now I'm going to test for sharp and dull. Frankie, can you feel this?
Yes.
Okay, and now dull. Say yes every time.
Yes.
Did you feel it all the way down?
Yep.
Okay, great. Now I'm going to assess for the Babinski reflex. Very good. Very good. Babinski reflex is negative because the toes curl forward. Now, if I could just have you scoop forward so I could take your quadricep reflex, please. Let your knees dangle, and I'm going to elicit. Very good. Very good. Reflexes are a 2+. Now I'm going to assess the upper extremities. I'm going to look at the color. There's no cyanosis, there's no polyp, there's no rugosities. The cap refill is less than 2 seconds on both sides. The shoulders, elbows, and wrists have no redness, no edema, or deformities. The hair is distributed. I'm going to take the radial pulses. They are +2 on both sides. The brachial pulses are +2 on both sides. We're going to assess for range of motion. We're going to do flexion, extension, hyperextension, abduction, adduction. We're going to bend your elbows. I'm going to do external rotation, internal rotation, and now we're going to go to your wrists. No, we'll go to your elbows first. We're going to do flexion, extension, and then we're going to do pronation, supination. Now we're going to do the wrists, and we're going to do flexion, extension, hyperextension. We're going to do radial deviation, ulnar deviation, and patient has full range of motion, no limitations. Now I'm going to test the muscle strength. Their muscles are symmetric, there's no atrophy. Can you hold your hands like this? Resist me pulling. Okay, now resist me pushing. No, keep your hands that way. Resist me pushing. Very good. Can you squeeze my fingers? Very good. Muscle strength is a 5 bilaterally. Now, going to test your spine. So if you could stand up and bend forward a little bit. Okay. I'm going to assess. There is no kyphosis, no hunchback. There's no spinal S curvature. There's no scoliosis, and there's no inward curvature. There's no lordosis. I'm going to palpate the sides of the spine. Tell me if you feel any tenderness.
No.
No paraspinal tenderness. Okay, look up. Okay, I'm going to have you touch your toes. I'm going to check for, this is checking for cervical, lumbar, range of motion. Okay, I'm going to have you look up, look down, look way back. Okay, look straight. Now I'm going to we're going to do rotation, cervical rotation. So turn your head to the right, turn your head to the left. Okay, now touch your ear to your left shoulder, your ear to your right shoulder. Okay. Now I'm going to have you lean back. Okay. Now I'm going to have you touch your hand on the side of your leg. Yep. Now the other side. We'll try to stay up and go like face me. Turn around. Face me. Go like this. Go like this. Okay. Very good. Now I'm going to have you close your eyes and stand straight. No Romberg is negative. There's no swaying. Okay, open your eyes. Now I'm going to test for alternating rapid movements. Can you do one hand first and then the other hand like this? Okay, the other hand. Movements are smooth and accurate. Okay. Okay. Reflexes. All right, sit down. Oh, I can't remember. Okay. Oh, yeah. Cerebral motor is the Romberg and the alternating movements. The spinal is what did I forget?